There are dozens of supplements marketed for prostate health. But do they actually work? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today I'm going to walk you through the supplements that actually have science behind them, what they can and can't do, and how to use them intelligently. I'll also tell you about the one supplement most men are taking for sleep that might be making their nighttime bathroom trips worse. Guys, in the supplement space, marketing has gotten way ahead of science. When you walk into any supplement aisle, you'll see dozens of products claiming to support prostate health. Most of them are based on weak evidence, animal studies, or no evidence at all. But that doesn't mean the entire category is worthless. There are a handful of compounds that have been tested in real clinical trials in real men with real outcomes measured. And some of them have shown some benefit, and a few have even been compared directly to prescription medications. So let me walk you through the science. Now, one caveat is that supplements are not regulated in the same way as prescription drugs. Quality, purity, and dosing can vary dramatically between brands. So if you decide to try any of these, look for products that have been third-party tested, USP, NSF, or consumer lab verified. All right, so let's get into it. The first supplement I'm going to talk about is saw palmetto or Serenoa repens. This is the most studied supplement in all of urology. Saw palmetto is by far the most widely used supplement for prostate symptoms and has the most clinical trial data. It's also the one with sort of mixed evidence. Here's why. Not all saw palmetto extracts are the same, and they extract saw palmetto in different methods. There's a hexane extracted form, which is most often found in Europe under a brand name Permixin, and it has a different chemical profile than ethanolic or supercritical CO2 extracts, which you can commonly find in the US. When you compare hexane extract saw palmetto head-to-head with tamsulosin or Flomax, the most commonly prescribed alpha blocker medication, the hexane extract showed similar improvements in symptom scores and flow rates. However, in 2011, JAMA, a very well-respected medical journal, published a randomized controlled trial where they increased doses of saw palmetto extracts using ethanolic extract and found no benefit compared to placebo at any dose. In 2023, a Cochrane review pooled data from multiple extract types, included that saw palmetto overall showed no significant benefit. However, they did acknowledge that hexane extract appeared to perform differently. And then in 2026, there was a multi-center randomized study that further confirmed that hexane extract of saw palmetto combined with an alpha blocker like Flomax produced significantly greater symptom improvement than the alpha blocker alone. What does this mean for you? If you're going to try saw palmetto, the extraction method matters. Ideally, hexane extracted form has the strongest evidence, and generic saw palmetto capsules may not have the same active compounds. And even with the best extract, you'll have to take it for at least 3 to 6 months before judging on whether it's working. Next up is pumpkin seed extract or Cucurbita Pepo. Now, pumpkin seeds are rich in zinc, phytosterols, including beta-sitosterol, which you'll hear about later, and essential fatty acids. And all of these have mechanisms that are relevant to improving prostate health. So there was a 24-month non-interventional study where they took 130 men with moderate BPH symptoms, and they saw that pumpkin seed extract produced a significant improvement in symptoms and quality of life scores out to 2 years. Now, this is non-interventional, meaning they don't have a placebo arm, and there was a small number of patients. So it's unclear if this is just a placebo effect. Next one is beta-sitosterol. Beta-sitosterol is a plant sterol found in nuts, seeds, vegetables, and plant oils. It's also present in saw palmetto and pumpkin seed extracts, and there's a reason that people believe it may be one of the key active compounds that helps see their benefits. Laboratory research shows that beta-sitosterol inhibits prostate smooth muscle contraction as well as growth. So it's working on both sort of reasons for urinary symptoms that are bothersome. There was also a Cochrane review looking at 4 randomized trials that found beta-sitosterol significantly improved urinary symptoms as well as how quickly the urinary flow was compared to placebo in guys who had mild to moderate BPH. Now, the Cochrane review hasn't been updated since 2000. That's 26 years ago? So the long-term data is limited, but the mechanism is plausible and it's relatively safe. Pygeum Africanum or African plum is extracted from the bark of African plum trees, and it's been used in European medicine for decades. A systematic review and meta-analysis of 18 randomized trials with over 1,500 men found that compared to placebo, Pygeum produced a moderately large improvement in urinary symptoms. Men taking Pygeum were more than twice as likely to report overall symptom improvement, improve waking up less at night, and emptying their bladder better by about 24%. The urine flow also increased by about 23%. Now, of course, it's limited. Studies were short, only about 64 days in length, and they used a variety of different preparations. So there's no real long-term data. Next one is pollen extract, or Cernilton or Cernitin. This is a ryegrass pollen extract that's been used in Europe and Japan for prostate and pelvic symptoms. So a systematic review of 4 trials found that this improved self-rated urinary symptoms compared to placebo, so guys felt like their urinary symptoms were better, and reduced nighttime waking. But what really they saw improvements in is chronic prostatitis and pelvic pain. There's a phase 3 randomized trial that found it significantly improved pain, quality of life, and symptom scores compared to placebo in guys who had inflammatory chronic pelvic pain syndrome. In terms of enlarged prostate symptoms, again, small studies, short studies, but generally it's well tolerated with minimal side effects. Now, if you also have pelvic pain or discomfort, this may be a good option for you. Next up is Lycopene. Lycopene is the carotenoid that gives tomatoes, watermelons, and pink grapefruit its red color. It's basically a very strong antioxidant, and it has anti-inflammatory properties. So there is a pilot randomized trial of only 40 men with BPH that found 15 milligrams of lycopene daily for 6 months, decreased PSA levels, which is a blood test, prevented further enlargement of the prostate, and improved symptom scores. Ultimately, there was a significantly greater effect than placebo. There's also a ProComb trial, which is a multi-center, double-blinded randomized study, so very high-quality study that looked at a combination of saw palmetto, lycopene, and selenium against Flomax alone and against the combination of all 3 plus tamsulosin or Flomax. Now, the combination therapy of everything together outperformed all the solo therapies or monotherapies, including symptom scores, urine flow, and residual volume, or how much urine is left in the bladder, at 12 months, so 1 year. From that, we suggest that lycopene probably works best as part of a combination approach rather than a standalone supplement. You can also get a meaningful amount through your diet. Cooked tomatoes, especially tomato paste, tomato sauce, and watermelon have tons of lycopene. And when you cook it, especially the tomatoes, it increases the bioavailability of lycopene. So I generally tell people, if you like tomatoes, cook them, eat them regularly, and that will help. Next one is stinging nettle root, or Urtica Dioica. Now, stinging nettle root works by some proposed mechanisms. It may bind to sex hormone binding globulin and have some anti-inflammatory effects. However, most of the evidence is with stinging nettle root with other properties. So there's a study where it looked at it with saw palmetto, and they used a proprietary combination with saw palmetto and nettle root extract, and it's been shown together they work as an antioxidant, and it might prevent prostate cell growth. Now, several clinical studies used this combination. It's actually an herbal medicine that's used in parts of Europe quite frequently for this issue. So if you're going to use it, probably by itself, not very effective, but maybe with saw palmetto, it will have some benefit on BPH symptoms. Next one is vitamin D. Vitamin D is not a prostate supplement, but it does have a connection. So multiple observational studies have found that guys who have vitamin D deficiency have larger prostates and higher PSA. They also have worse symptoms and lower flow rates compared to guys with normal vitamin D levels. And so a randomized controlled trial of about 108 men found that those who supplemented vitamin D3 with 50,000 units every 2 weeks for 6 months had reduced prostate volume, PSA levels, symptom scores compared to placebo. Now, it's not a treatment, obviously, but if you're deficient for vitamin D, you should absolutely supplement because it may help your urinary symptoms and your prostate health. So make sure to get your vitamin D checked. Now, remember from the beginning of the video, I said there's a supplement that men are taking before sleep that might be relevant, and that's magnesium. When you take certain types of magnesium, like magnesium oxide or citrate, your body has to flush extra magnesium through the kidneys. To do that, your kidneys pull in extra water. So if you take magnesium right before bed, your body is actively producing more urine while you try to sleep. For someone who already already has a bladder that's a little bit sensitive because of an enlarged prostate, that extra water production is going to make you wake up more often to go to the bathroom. So the solution then is not to have to stop your magnesium if you're deficient or need it. It's to actually just take it a bit earlier, like with dinner rather than right before bed, so the kidney can process it before bedtime. So if you're considering a supplement because you're having bothersome urinary symptoms, here's how I would think about it. We have the strongest evidence for the hexane extract of saw palmetto, beta-sitosterol, and Pygeum Africanum. They do have clinical trial support, but they're not all really strong trials. When you combine some of these things together, like saw palmetto with lycopene and selenium, they tend to outperform single agents. Importantly, you need to give supplements times. Unlike medications like alpha blockers that work within days, most supplements need 3 to 6 months of really consistent use before you're going to see the benefits. So if you're really struggling, I would strongly consider a pharmacologic approach otherwise. They also work as part of a comprehensive approach. They're not going to fix things that you're not fixing with lifestyle. And we talked about lifestyle changes in my video about how to stop peeing at night. And if you're not doing those, the supplements are not really going to help. And if you're really having significant bothersome symptoms, see a doctor, talk to your urologist, because it's so important. And anytime you start a supplement, talk to your doctor, because supplements can interact with prescription drugs and your doctor needs to know what you're taking. If you want to learn more about your prostate, I have a book coming out called The Hard Truth. We talk all about men's health, including sexual health and prostate health, and really how to build the foundation for your overall health and your sexual health for it to last throughout your life. Check it out at renamalikmd.com/hardtruth. I realize pre-ordering is not something most people want to do, but the reality is when you pre-order this book, it's a signal for bookstores, for publishers to know that, hey, men's health matters and you guys need to pay attention because we need books and content that are made for men. So thank you so much. And as always, remember to take care of yourself because you're worth it.